consultant dermatologist at Kindred Hospital, Bangalore, associated with Dr. Karishma Aesthetics. Today I'll be talking about skincare during pregnancy. I'll be mainly discussing what skin issues the new moms come to me with and how to manage them. So, in a recent study, which was conducted in India, so they conducted a study to see what are the major skin concerns in pregnant women, and the most common skin concern was pigmentation. So pigmentation can be there anywhere on your face, on your body. So the most common pigmentation I see in my patients during pregnancy is something called melasma. It's also called mask of pregnancy. So in this kind of pigmentation, you have dark spots and pigmentation over your cheeks, nose, forehead, and sometimes over the upper lip area. So this can be treated during pregnancy also, but you'll have to consult your dermatologist because few creams cannot be given during pregnancy and few procedures cannot be done during pregnancy because creams also can penetrate your skin and go to your fetus and it can affect your pregnancy. So make sure you consult your dermatologist before using any of the creams for any skin conditions and in general for any infections or as such also. So the pigmentation during pregnancy is completely reversible. So when coming to melasma, we start off few creams like sunscreen and few skin lightening creams, and also we do few procedures like chemical peels which is safe during pregnancy. So especially I would give a tip not to use the over-the-counter skin lightening creams because few creams like hydroquinone and especially few creams like triple combination which is commonly prescribed for melasma and such pigmentation have some contents like retinoids, which is harmful for pregnancy. So avoid over-the-counter creams, especially skin lightening creams. And the other kind of pigmentation on your body, the most common pigmentation would be around your neck folds or like body folds called acanthosis. So what happens during pregnancy is you put on weight and this can increase your insulin resistance. It can cause this kind of pigmentation around your body folds called acanthosis. Again, we also start off few creams and we can do procedures during pregnancy also. So apart from this, also you can see when you have a tendency for moles and freckles, these can increase during pregnancy. This is very common. So if you're someone who has a family history of like moles, freckles or something like melasma, it is always better to start preventive treatment or preventive creams from the beginning of pregnancy itself, preferably in the first trimester. And next common skin concern they come to me with this hormonal acne. So you might be someone who has never faced acne issues during your teenage or adult life, but still you can have acne during pregnancy. So what happens is again the hormonal surge, lot of hormones, right? So this can cause acne, especially like progesterone, which is very comedogenic. So again, like acne, better to treat during pregnancy also because like once your acne is very inflammatory, it can leave pigmentation and scars, which are a little difficult to treat. So again, like always consult your dermatologist. Don't use any over-the-counter medications, especially retinoids, like I already discussed before. So this is another issue they come up with. So also we give few creams and then procedures like chemical peel can be done for acne also during pregnancy, which is safe. And the next common issue everyone is worried about and heard of is striae or stretch marks. So what happens during pregnancy is like you tend to put on weight and there's a lot of pull and strain on your muscles and body also. So what happens is your collagen and elastin fibers, they tend to stretch and that causes your stretch marks. So one thing is like keep your skin moisturized and also like try to put on your weight slow and steady. Don't put on like complete weight during the first trimester or like in few months itself. Throughout your pregnancy, try to put on weight slow and steady. This can prevent stretch marks to some extent. Also, if you keep your skin moisturized, to some extent it can prevent the severity of your stretch marks. But you have to understand stretch marks is like a mark of pregnancy. You have to accept it gracefully. And we cannot do anything for stretch marks as such during pregnancy, but only thing is you can keep your skin moisturized. Probably once your pregnancy and lactation is done, then we can work on it. Like we can do a few procedures, we can start off creams, but during pregnancy you just have to keep it moisturized and trying to prevent the severity of stretch marks is what can be done maximum. And other concern, like most of my patients come with is like they have like a lot of itching and pruritus developing during pregnancy. Some people develop it during second trimester and some people during the third trimester. So most of the like times it can be because of dryness, and sometimes you can have like these kind of itching in second and third trimester because of a condition called pregnancy dermatosis. It's a wide spectrum. You have a lot of skin diseases which can cause itching during pregnancy. It's related to pregnancy. So if you are using moisturizer regularly and in spite of that your itching is too much, so just consult us once. Let's evaluate and see what is causing it. Also, like your infections can increase during pregnancy because like your immune status will be little low. So we have to rule out if it's an infection or related to the pregnancy itself. So we can just evaluate you once and then decide. So yeah, so these are the most common concerns I see among the patients during pregnancy. And also apart from this, so you have to make sure you don't use any over-the-counter products, and also if you're doing any procedures or any salon procedures or even matter of fact hair dye or anything to your skin, make sure you always like consult your gynecologist or dermatologist and see if it is safe to use during pregnancy. That is very important. So take home message would be like keep your preventive skincare on check. Like I said, if you have a family history of pigmentation or like for your stretch marks, just start off the preventive treatment right from your first trimester. And also avoid buying over-the-counter medications, because like I said, it's very important to cross-check always, even the creams or tablets, whatever you're taking, with your gynecologist or dermatologist. And whenever needed, please consult dermatologist. Don't treat yourself. Like make sure whatever the treatment you're taking is safe. Thank you. For any further information, you can contact our Kinder website.